I'm joined today again by our normal team with Director of the Delaware Emergency Management Agency, AJ Shaw. AJ, thanks for being with us and for you and your team and all you're doing and testing, vaccinations, and everything across the board, including dealing with the snowstorms and weather that we've had over the past couple of weeks, and with more to come. Dr. Carol Rattay, the Director of Division of Public Health. Dr. Rattay, thanks for joining in again, for your team, for just all the things that they've been doing over the last 2 years. And we're also joined today by a special guest, Dr. Ken Silverstein, who's the physician, the chief physician executive at Christiana Care. We appreciate you being with us and the work that your associates there, frontline healthcare providers, what they're doing every day. We also have Pam, who's with us, who is our sign language expert for the deaf and hard of hearing. We have a hospital representative again today because we have reached a point in our response to COVID where our hospital capacity has been stretched to the limit. Dr. Silverstein is going to talk about what that means in terms of the standard of care provided by the hospitals. They are just at their limit, which of course is the reason behind my decision this week to reimpose an indoor mask mandate to try to stem the tide of COVID-19 infections across our state. We're seeing them sweeping across Delaware. We'll look at those data in a moment, and really testing the capacity of our hospitals to respond and to all patients. They're seeing patients with other conditions, heart conditions and accidents and all the rest of it. But they're being burdened by almost a third or more, 40% of their capacity with treating COVID patients, many of whom could be prevented if we got everybody vaccinated. Still around 70% of those that are in the hospitals are unvaccinated Delawareans. So that's the most important thing that anybody can do for yourself, family members, loved ones, and for the community, and for those frontline health workers that you would need if you found yourself with a very significant health crisis and found yourself in the emergency room. We thank Dr. Silverstein, representing all those nurses, all those folks working in our hospitals. I've also called out the National Guard. The cavalry's has arrived today with additional hands of guardsmen and women who've been dispatched to hospitals across Delaware to do kind of the unskilled work that just needs another set of hands, as well as another 100 being trained to help decompress the hospitals to discharge folks that don't need hospital care. AJ, talk a little bit more about that, and I'm sure there'll be questions. So we're at a critical point once again in the winter months, when people are inside, they're grouping together with watching maybe the college championship, NCAA football championship last night. Unfortunately, maybe with other people, I was sitting there watching it with my wife, Tracy, by ourselves, and not putting others at risk. And we know that those things are going to happen, and we just need people to take special care when they're in public places, indoors, and wear a mask. So let's take a look at the data. We're seeing on a 7-day moving average, a number of positive cases that we've never seen, approaching 3,000 a day on a 7-day moving average at 2753. Of course, the number that's driving so much of our decision is the hospitalizations there at 734. You'll remember that these are individuals that are tested in the hospital, they're counted in the hospital. This is a number that we know. It's not relative to the number of tests that are being done. It's a discrete number, and it compares to the peak of last year when we had very few people vaccinated, which was 474. And at that level, at 474, didn't tax the resources of the hospital, their capacity as much, because we were shut down, otherwise pretty shut down. Businesses were closed, limited capacity indoors. And so our traffic counts were way down, traffic accidents were down, and therefore the hospitals were able to take care of the normal patients that they get, as well as the 474 COVID patients that were coming through the doors. today, that numbers or yesterday, that number was 734, and has been increasing pretty dramatically over the last couple of weeks, which has prompted us to make the decision to go with an indoor mask requirement. The positive case, we're testing at levels that we've never tested before, maybe once before, about this time last year in early January with the peak back then. And almost a full third of those tests now are positive, which is just an indication of the extent of the spread across our communities in our state. And sadly, of course, those that have lost their lives from COVID, almost 2,400, everyone, a family member, a friend, a precious life for sure. Here's the roller coaster ride that I was referring to, 474 at the peak last year on January the 14th. And today, of course, we're way over 700 at 734, significantly higher than that, and with more patients in the hospitals, as we can see in the next slide. The gray are the number of patients in hospitals for other reasons, and then the blue, dark blue to purple are the COVID-19 patients, and you can see an increasing percentage of those patients are there for with COVID-19, and stretching and stressing the emergency resources and the capacity of our hospitals, prompting us to take stronger action to stem the tide of new infections. Here's our vaccine update. We're still doing a pretty good job with over 1.6 million vaccines administered. Almost 65% of Delawareans fully vaccinated at 630,000. And then, of course, the breakdown, Delawareans over 65%, age 65, fully vaccinated, 93%, 75%, 18 and older. So we lose some folks. We know that the least vaccinated demographic group are those young adults 18 to 35. And so if you're in that category, you need to get out there and get your shot. 12 and over, 73%, and then 5 and over, those younger ones just recently eligible and fully vaccinated at 68%. So as a result of the surge in cases, and in particular, the stress of the hospital capacity across our state, from Beebe to Tidal Health, Nanticoke, Bay Health, St. Francis, the VA, Christiana Care, really just busting out at the seams and stretching their ability to provide the kind of service they do normally on an everyday basis. Obviously still treating their patients, but being stressed to do so. And they're seeing, obviously, their workers and frontline providers are testing positive as well and have to be out of work as they quarantine as a close contact or somebody tests positive, which stretches their ability to respond. So we have reimposed the universal indoor mask mandate, hopefully for not an extended period of time, but just enough to stem the increase in hospitalizations, to reduce the number of hospitalizations there, and that we can achieve that. My hope was that we would be able to accomplish it by voluntary compliance, by private employers stepping up to the plate and doing what CDC was recommending, which is that people vaccinated or not wear masks indoors. That didn't seem to work, and so we were pushed to the limit with our hospitalization number and decided to pull out the stops. Everybody's got to be part of this solution, and so we're asking everybody to wear a mask when indoors to protect themselves, the workers in those various establishments, family members, and most importantly, the capacity in our hospitals, which is driving us to make this decision. As I said, our hospitals are facing a crisis level situation. You're going to hear from Dr. Silverstein in a minute. We've seen a record number of Delawareans who are rushing to the emergency room. We've been seeing a movement from predominantly the Delta variant to the Omicron variant. And Dr. Rattay might talk a little bit about that. We've been seeing that, and she's been talking about it for some time. But in any case, the Omicron variant variant seems to be more contagious and it moves one to another. There are some who say it creates not a serious illness, but we're seeing when you're seriously ill and you're in the hospital, that's one case that the hospitals need to take care of. And that's why we need all Delawareans to join in the fight by wearing a mask indoors. Our major focus, as I said, will be directed towards helping our hospitals decompress. And so I've called up another 100 plus National Guardsmen and women to do this, to work with us, work with the hospitals as extra hands. We've dispatched today about 70 plus National Guardsmen and women to hospitals from Sussex County up through central Delaware, up to the northern part of our state, to provide an extra set of hands in emergency rooms and in the hospitals where they're stretched to the limit. We're also using, as I've mentioned over the last 2 weeks, 100 or so National Guardsmen and women are being trained up to provide service, trained up to be CNAs, to provide service to enable the hospitals to discharge patients that are in their facilities that don't need hospital care, but can do fine in an alternative care setting. We're finalizing the details of that, but the goal is really simple and clear, which is to decompress the hospitals, help them with their overcrowding, enable them to discharge patients who don't need hospital care, many of whom will be elderly or not able to find a long-term care facility that will take them. And so we're putting our National Guardsmen and women to that task to really help the hospitals in that regard and drive that number down, that 734 number down, and help them with all the things that they're doing for all the rest of us. So we have more than 300 members of the Guard now that are assisting with our COVID-19 response. Some of those are working, doing testing and vaccination clinics as they've been for months. And then this new group assisting with, in an unskilled kind of way, another set of hands with our hospitals, and then our emergency trained CNAs who are going to help us decompress the hospital census. What can you do with this winter surge? You can follow our mandate to wear masks indoors. We do have, for businesses, printable signs that are available. I notice in some of the places that I go in the morning that they had the signs up on the door. Masks are required indoors. Please follow that mandate to protect those employees that you encounter in that facility, as well as yourself and other customers and those businesses. You can get the signs available at de.gov/biz signs. You can use them for the doors of your establishment. One of the things that is being a real challenge now is meeting the demand for COVID-19 tests. We're seeing a lot of people come to the emergency rooms. They don't need emergency care, but they're coming there to get a COVID-19 test. Please don't do that. If you are sick, just stay home. And for business owners out there, if you haven't, you should be telling your employees if they're showing symptoms that they should stay home and not put others at risk. And hopefully we'll find a way to get them tested to determine what those symptoms are, what's causing those symptoms. So I wanted to show today the number of tests that we are doing. We're pretty maxed out or getting close to being maxed out with our capacity. We have some good news there with respect to federal resources that are on our way. You can see the daily tests that were performed over the last couple of years here. Another peak again this time last December, January, when we saw our winter peak of 474, January the 12th. And now you're seeing our daily peaks in tests in 8,900 there, which is our 7-day moving average as of January 8th. AJ is going to talk a little bit about that. We have fixed testing sites across the state. Here's a map that shows a little with pins and where all those test sites are. They're at state service centers, public health clinics, at Walgreens. And in the first week of January, we did 61,128 tests. When we first started this 2 years ago, CDC recommended that we need to do 80,000 tests a month. for an adequate testing program. And you can see we did 61,000 in a week. And we're not doing 61,000 every week, but we're pressing in on over the 50,000 mark, 40, 50,000 a week, far in excess of what the original CDC recommendation was. So if you go on their website, you need to get tested and really make sure that you need to do it. You can go on de.gov/get tested. AJ is going to have more about that in a minute. Help is on the way. As I said, we've had a request in for a couple of weeks to FEMA to set up a mass testing site. This is a overhead photograph of one of our vaccination sites at the Delaware DMV, and that's where the testing site's going to be. More details will be coming there about the time, but we expect it'll be at night and weekend hours so folks can get it on their way home from work or on the weekends. Again, AJ will talk more about that. Bottom line is you can help us stop the spread of COVID, meet to stem the demand for emergency services at our hospitals by getting your vaccination. If you haven't, if you're one of the 25% or so that have not received the shot, get out there and get your vaccine, de.gov/getmyvaccine. Lots of vaccine availability out there. Please pitch in, get your vaccine, wear your mask indoors, protect those employees that you encounter, and most of all, help our hospitals, help our emergency service employees, both on the ambulance and in the emergency rooms. And together we're going to get through this. So with that, I'm going to turn it over to Dr. Rattay. Dr. Rattay, thank you for your great work and the work of your team. I know we've met. We're approaching another serious situation here in this pandemic, and we appreciate all the things that your team is doing.
Thank you so much, Governor. So as many of you have seen me talk about our areas of concern in the state, and again, our concern about cases continues to be statewide. So I'm not going to show the areas of concern map this week. The realities we are seeing, the serious impact of Omicron spread and holiday gatherings as we continue to see a significant increase in numbers of cases and hospitalizations. I wanted to mention the governor was mentioning percent of Omicron cases, which we are seeing an increase in our state from the specimen collected the week of December 20th and then sequenced in our lab. 78% of those that sequenced positive for a variant of concern or variant of interest were Omicron. So again, 78% now at this point of our sequenced cases were Omicron, and the remaining 22% of sequenced cases were identified as Delta. So we've definitely seen the shift in our laboratory, as well as certainly out there in the community. So let's talk about the hospital impact. As we've said since the beginning of the pandemic, that hospitalizations really are one of the truest indicators of spread in the community, even though it's a lagging indicator. So given our significant increases in cases, we are very concerned that hospitalization rates are going to continue to increase. And as the governor mentioned, we do currently have 734 people in the hospital with COVID. 72 of those are in the ICU, 51 are on ventilators. And when you look at the overall, number of people who are hospitalized, 2 out of 5 or 40% who are hospitalized are positive for COVID-19, which is really quite astonishing. And additionally, the hospitals are reporting increased number of patients who are hospitalized for influenza as well, which is really complicating the situation. So right now, our hospitals are over capacity, and you'll hear more from Dr. Silverstein. But on average, our hospitals are really operating right now at about 117% of their capacity. Christiana Care and Beebe are at approximately 130% of their capacity. And even Nemours, while Nemours is not over capacity, this past Sunday, they hit a high water mark for children hospitalized with COVID at 70. So very importantly, overall, approximately 70% of those who are hospitalized with COVID are either not vaccinated or only partially vaccinated, and 90% are not boosted. And so that really shows you, again, when you think back to the numbers the governor shared, the majority now of Delawareans are fully vaccinated, but certainly the majority of those who are hospitalized are not vaccinated. So those who are not vaccinated in the hospital tend to be younger. Those who are vaccinated and hospitalized tend to be much older and also are more likely to be immunosuppressed or immunocompromised. So I want to talk about testing again. I talked about this last week, but just as a reminder, because we're hearing among the many challenges around testing that people are really confused about who does need to get tested. And I want to break it down to make it as simple as I can. You should get tested if you have symptoms, if you've been exposed, or if you're not vaccinated. So let me talk about each of those. If you have symptoms of COVID, which is we talked about last week, could be now just common cold symptoms. If you have symptoms, and especially if you are not vaccinated, or if you have serious or chronic underlying health conditions, you need to get tested. This is important because this is a group of people who may be eligible for some of the anti-COVID medications, either the monoclonal antibodies or the antivirals. So again, if you have symptoms and you're at high risk, especially if you're unvaccinated, it's important you get tested. Just for right now, we expect the demand to change over time, but for right now, because demanding is so high, if you're not at high risk, you should still look for a test and try to get a test. But if you can't find a test immediately, please assume that if you have symptoms, that it is COVID, and you should isolate at home and follow the isolation guidance. For those who've been exposed to somebody with COVID-19, it really is important that you get tested so that you know if you have converted to be COVID positive or not. So if you have been exposed to someone with COVID, regardless of your vaccination status, you should get tested about 5 days after your exposure, if possible. And if you are not vaccinated, we are still recommending that those who are not vaccinated should be tested for COVID once a week. So let's talk a little bit more about some other testing suggestions that you should know. You want to make sure before you get tested that you check the testing calendar and also follow DPH social media for closures due to weather. We also, just like everyone else, have our testing partners have dealt with staffing shortages, which may very well lead to some closures of some of our staffing sites. So make sure you check before you go out to get tested. Also, very importantly, we know everyone wants a rapid test right now, but not everyone needs a rapid test. In fact, most people really don't need a rapid test. Those who should especially seek a rapid test include those with symptoms, especially those at high risk, but also children who are needing to return to school. Please practice patience and kindness with testing staff. We've heard a lot of examples of people losing their temper because they can't access a test or the type of test that they want. Again, please practice patience and kindness with these folks who are really trying hard to serve Delawareans. I want to make a mention about contact tracing. We've discussed before that with the record number of COVID-19 cases, our contact tracers just aren't able to reach every case in contact. And so we are prioritizing our outreach to positive cases and their close contacts in places like schools, as well as long-term care facilities and congregate settings. We're also focusing on children and those who are age 65 and older. So there are many people who either test positive or who are contacts that are not going to get a call at this point in time. If you test positive, please don't wait for a call from a contact tracer to isolate. By the time you get your results and they're entered into the system and you would get a call from a contact tracer, because of the current backlog, as well as reduced isolation and quarantine time, your time may already be up. So isolate from the day you have symptoms or from the time you get a positive test result. And also, please take charge of reaching out to your close contacts who you were around either in the 48-hour period before your positive test or the 48-hour period before your symptom onset. Please let them know that they were a close contact and advise them to quarantine based on CDC guidance, which of course is available at CDC or at de.gov/coronavirus under isolation and quarantine. They'll be recommended to quarantine or not based on their vaccination status. But for all who are close contacts, again, they should test 5 days after their last exposure to a positive case. I also want to revisit the topic of masks again today. This has been a really hot topic in the last week and a lot of conflicting information going on. And again, because Omicron is different. Omicron is so contagious, appears to be airborne. We've really been taking a fresh look at masks to make sure that our guidance is clear about how best to wear a mask, what masks are best to be the most protective in preventing the spread. Now, for weeks, we have been recommending wearing masks in all indoor settings, and some people have been following those recommendations. So thank you for those who were voluntarily following the recommendations. But the reality is we know many people have not been following those recommendations. So mandating masks in public settings is very important, but it's also extremely important that masks be worn in private settings as well, especially when you are around people who are outside of your household. At this stage, it's so important for people to be wearing the right kind of mask since Omicron is so transmissible. The science backs what CDC has been saying all along, which is the best masks are masks with multiple layers. And in addition to having multiple layers, it's important that you wear masks that fit snugly around the nose and the mouth. A well-fitting mask does not allow for gaps around the nose or the side of the face. You should wear a mask that has a wire strip at the nose so you can shape it to your nose. So this is really important that you don't have gaps around the side of your face. Some experts are now suggesting that you either ditch the cloth mask or use a cloth mask over a surgical mask for better protection and fit. Cloth masks can work, but they need to be multiple layer and they need to fit snugly around the face. And same with surgical masks. So again, you can wear them, but you want to make sure they fit snugly. And also that they have multiple layers. Again, many people are wearing the surgical mask with a cloth mask over, and that can work very well. But another option, an option that I really like is the KN95 mask, because the way they're designed, they really do fit snugly around your face. They're also very comfortable to wear because they don't sit right up against your mouth. But again, beware, there are some counterfeit KN95s out there. So it's important to check to make sure that they're either FDA or NIOSH approved. There's a lot of good sites on the internet now to help you with this. N95 masks, which really have been reserved for healthcare professionals. They are much more readily available now. So it is fine to use those. They're certainly very protective, although they may not be as comfortable as some of the other masks that we've been talking about. But bottom line is masks are an extremely effective prevention measure when used correctly, and they are safe for adults and for children. I want to close on a prevention slide. While we all need to do what we can to get through this next month to avoid a collapse of our health system and maintain critical functions like in-person schooling. These prevention measures that I'm going to mention here, you all know them, but they make a tremendous impact. Vaccination is critical, as you have been hearing, and you'll hear more. Most of the people who are hospitalized, most of the people who are getting the sickest are unvaccinated, which really is having a tremendous impact on our healthcare system. We've already talked about masks, but please wear quality and well-fitting masks. We know they make a difference. And of course, AJ is going to talk about testing. Testing is a great tool, but given that the demand has outstripped the supply, right now, we want to make sure that those who are getting tested are the ones who need it the most. So if you have tested positive in the last 3 months, please don't use a test. Or if you've been vaccinated and boosted and you don't have symptoms or you have not been exposed, you don't need routine testing. And certainly please don't repeat tests unless they are indicated. And one final slide, which is shifting gears, but really relevant to our pandemic situation, is insurance. Open enrollment on Delaware's health insurance marketplace ends this Saturday on January 15th. So we are coming close to that date. And if you've lost your coverage during the pandemic, it's really important for you to take advantage of this opportunity and sign up for affordable coverage through the marketplace. Already 30,000 Delawareans have enrolled for coverage, and more than 80% of these individuals are eligible for financial assistance to reduce their monthly premiums. The enhanced federal subsidies by the Biden administration have helped to reduce consumer costs by as much as 40%. So it's not too late for your family or you to sign up. For more information, including a connection to in-person assistance in Delaware, go to choosehealthde.com, or just to sign up for coverage, go to healthcare.gov. So with that, I am going to hand it back to you, Governor. Thank you so much.
Thank you, Dr. Rattay. Really good information there about masks, the kind of masks to wear, doubling those cloth masks up, wearing the KN95 masks, and to be careful or to be knowledgeable and responsible when getting tested. We got AJ up next, who would talk about our efforts both to help decompress the hospitals, deploying the guard, and testing and other information that AJ has to share. AJ?
No, thank you, Governor. Good afternoon, everybody. I think the governor went over kind of the high level impact of testing last week. We did have a near record-breaking week at 61,000 tests between the 1st and the 7th, which I think is a great number. I think we also know this was a little bit of a little bit off of what we could have done. We had a day and a half that we lost due to the snow events last week. We had some partners, as Dr. Tay alluded to, that are having some staffing challenges as well, with individuals coming down with COVID or being exposed to it, which changes up the rotation a little bit, and that's carried over a little bit this week as well. However, we do have multiple, initiatives that are lined up to kind of help strengthen this and bring other opportunities to the state. So first of all, I don't want to not mention our opportunity with Vault, which is an at-home test. It is a test that's requested by somebody online. It gets overnighted to you at your house. You collect the specimen through a Zoom session with the lab provider, and then after that, you drop it in a UPS or FedEx box overnight, and it gets to the lab. Right now, last week we only did about 3,000 of those. We have capacity to do a lot more with our partner Vault. They have a nine-hour turnaround time, so most of their tests get to the labs between 8 in the morning and 10 in the morning. And so usually by the time you go to bed at night or wake up the next morning, you'd have the results. So for individuals that need this for employment, that need this for travel, or looking to just do some regular testing, this is a great opportunity to really take the burden off of those that may be systematic, those that have been exposed and aren't vaccinated and have another opportunity out there. So go to de.gov/get-tested and look at that option. The other thing is we spoke to about earlier is we did a federal request. We are working on the last minute details with Dr. Rattay's team and our federal partners to have a 2 to 3 week drive-through testing site in Delaware City. It will be afternoon, I should say late afternoon, early evening hours, and then on the weekends, every day except Wednesday. More information to come on that. We're actually just dotting the I's, crossing the T's now. Figure out when the contractors and staff will get it in the state, when they'll set it up, when they'll do the soft opening and everything else. But we're excited that that will be coming down the line in the next 5 to 7 days. So in the near future to help release some of that stress and bring additional individuals in to do testing in the state. We also, when we talk about testing, and it kind of goes on to our next slide, is, we mentioned it last week, and again, we don't want individuals that are getting tested because of no symptoms or surveillance, employment, or some other reason, or to go back to work, to go to the emergency departments. We know that's a stress right now that the hospitals are unable to really accommodate. Here's our slide. We showed it every week. Governor goes through it. Great part of the slide is, and the graph is everybody that is in the hospitals, or that orange color are those that are still waiting for results but are anticipated to be COVID with their symptoms, and then the blues of COVID patients. You can just see how that spiked up over the last few weeks, and that is what the dire situation that we have in the hospitals right now, and that I think is what Dr. Silverstein will talk about after me. But what are we doing to help this? And I think we talk a lot, and I talked about it last week in one of the questions. The system around how we support hospitals and the healthcare system was never designed to impact and support a infrastructure across the country and across the globe. So we're getting very creative, and I think the men and women of our National Guard over the last 22 months, 23 months almost, have stepped up to do everything. They've delivered meals for school children. They have delivered Chromebooks. They have worked through the drive-through food pantry events. They have done testing. They have done call center duties. They have helped distribute PPE to nursing homes and hospitals and other medical providers. And now we've come to them with another ask. So about a month ago, right before the holidays, we were working on them. We're like, hey, we need to interview over 100 people. We want to start a CNA class with Del Tech. We are in week 2 of that. It's going very well. We'll have somewhere between 90 and 100 Guard members that will finish that towards the end of this week, early next week, that will be ready to be used as CNAs in either nursing home facilities, some type of post-acute care facility, or possibly the hospitals, wherever they're needed. But we also, we have weekly calls with the hospital leadership, and I think Dr. Tam from BB put it best. If we had able-bodied hands to just kind of help give us a little bit more flexibility, it would be a step in the right direction. So receiving those marching orders and going through some planning last week, we actually activated an entire Guard unit with General Barry's National Guard, about 180 people. By the time we looked through those individuals that we were activating and took out those that worked in education, public safety, healthcare settings, some of the critical infrastructure areas, we got down to about 70 people. Did some COVID testing, lost a few more there, but as of this morning, I had 56 individuals from the National Guard report to different hospitals across the state. They'll be working kind of this rest of this week as an orientation, just-in-time training to do everything from assist moving patients around the hospital, delivering meals, runners, some minor clerical work to just be that extra body in there. Then next week we're going to be adding additional individuals. We'll be going on a 7-day rotation of the National Guard members. They'll be there 10-hour days and kind of be covering multiple duties across the state. So we can't thank the National Guard enough. This is something that these men and women probably didn't think they'd be doing when they raised their right hand years ago. But the call yesterday with Major Malloy and Lieutenant Colonel Pennington and Sergeant Major Fields, they're ready. They're excited. Here's a picture of them from getting put on their orders yesterday and getting them information, and something that I think they could really say they're helping their state and their community prepare and tackle COVID now. So with that, Governor, I'll turn it back over to you.
Thank you, AJ. You're right. We can't thank the Guard enough for the amazing work that they've been doing over the last really 2 years, closing in on 2 years, and what we've called them up to do now. The photo that you have there on the screen with the men and women Guards, men getting their orders yesterday. This past weekend was a drill weekend, so it was an opportunity for General Barry. And thank you to General Barry and his command team for their great leadership during this difficult time. Just showing up with their uniforms on, I know, is moral support for all our exhausted frontline healthcare providers. And the cavalry has arrived in hospitals across our state, and we're preparing another contingent to come to help decompress the hospitals by allowing discharges to an alternative care facility, as you pointed out, to wherever that might be, and trying to finalize their details. Thank you to all the people and organizations that are helping with that. Everything that we've been talking about today is centered around the surge, unprecedented surge we've had in COVID-19 cases in our hospitals, and the stresses that has put on our hospital workers, on the facilities themselves. And here with us today again is Dr. Silverstein, the Chief Physician Executive, Christiana Care, to talk about what is meant by this crisis standard of care, the situation in their facilities, and just to help us communicate the dire need for all of us across the state to pitch in together, do the right thing, so that these incredible public servants can do their jobs and provide the life-saving healthcare services that we need, and they can be there when we need them. Dr. Silverstein, thanks for being with us today.
Sure thing, Governor, and thank you for the opportunity to be here today to talk about this issue, to talk about the crisis standards of care. And thank you for your service to our community during these challenging times, and in particular for your support of our healthcare system throughout this pandemic, including absolutely the introduction of this mask mandate most recently. I want to just echo and give a huge shout out to the National Guard, men and women. We did have folks show up at our Wilmington and Newark hospitals today. We had 18 people, and their assistance and support is appreciated. And as Governor, as you referenced, it's absolutely uplifting to see some help come through. We can go to the next slide. Thank you. We've confronted the challenges of this COVID-19 pandemic for nearly 2 years, meeting surges in demand for acute care with a wide variety of contingency strategies. We've had to pause or delay surgeries that are not time sensitive. We've repurposed space within our facilities to accommodate more patients, and we've directed available resources, including staff, to meet the increased needs of our hospitals and emergency departments. As you've already heard, we're caring for patients in hallways. We're stretched thin. The healthcare system is under unprecedented strain. Never has there been this many people in our community who need hospitalization, emergency care, and other healthcare services. Yesterday, Christiana Care, Bay Health, Tidal Health Nanticoke, and Trinity Health Mid-Atlantic St. Francis Hospital issued this joint statement regarding the COVID pandemic and the implementation of crisis standards of care. It's certainly a testament to the collaboration across these organizations that we could so readily gain consensus on taking this important step. I deeply appreciate the collegial relationship that I have with the outstanding clinical leaders at these institutions. We have had many opportunities to stay connected and have all benefited as we've faced the challenges presented to us by this pandemic. And while each organization implements these standards independently, there are common principles under which all of us operate. That we are at crisis levels is uncontested. Further, decisions regarding the use of resources will be made in a just, equitable, and transparent way. Guidelines adopted by the National Academy of Medicine, as well as the Delaware Health and Social Services Division of Public Health in its Crisis Standards of Care concept of operations, provide a strong and clear direction for us. And we can go to the next slide. While our commitment to meeting the needs of our community is unwavering, we have reached crisis level where the demand for our services is such that we can no longer consistently meet normal standards of care delivery. Modification of practice standards is required in accordance with the ability to provide the most essential elements of care to those in the greatest need. If we can move to the next slide. The official implementation of crisis standards of care is defined in policy at Christiana Care. It's not a step that we've ever actually had to take. And the crisis standards of care protocols are put into place when there is a need to extend key resources while minimizing the impact of shortages on clinical care. These protocols are an extension of the surge capacity planning we've been doing over the course of the entire pandemic. These are emergency plans we always have at the ready, but plans we've had to really rely on during the last 2 years as we've faced wave after wave of COVID. And they provide a framework in which healthcare providers can change the way they work in order to care for patients with the highest need. We can move to the next slide. The implementation of these crisis standards of care allows for greater flexibility regarding certain actions that we can take at this point. And let me, if I can, offer a few examples to try and highlight the range of the modifications we might consider. But we'll start with our dietary services team. They're committed to providing hot meals to all of the patients in our acute care facilities. But given staffing shortages, our caregivers, while eager to meet their own expectations of excellence in service, now make choices as to who gets a hot meal and who may have to wait. Nurses give medications to their patients on a schedule. Now, not everyone who's due their 8 a.m. dose will get it. Nurses must prioritize who must get their medication at 8 and who can safely wait an hour without consequence. And this runs all the way up to decisions regarding monoclonal antibodies. You've heard of these medications that have been effective in treating ambulatory patients who test positive with COVID. These medications are in short supply, and we're required to make clinical prioritization decisions as to who should receive them. Crisis standards of care allow us to facilitate decision-making such as this across an entire spectrum of scenarios. If we can go to the next slide. The result of the implementation of these crisis standards of care, one of those, the results of that is raising of public awareness. Through our announcement, your health systems are communicating proactively and openly, alerting the community about the dire circumstances that we face. This imbalance between the demand for healthcare services and our ability to provide them. This is a call for partnership, asking the public for your help in stemming the tide of this pandemic. Curbing the spread of infection starts with vaccination. Get vaccinated, get boosted when eligible, and be mindful of your social interactions. Wear a mask, socially distance, wash your hands, stay at home if you're ill with manageable symptoms. Further, help us with the overwhelming number of people seeking care at our facilities. We just do not have the capacity to do routine testing or treat mild disease. Please avoid our emergency departments for less serious issues. We need to marshal our resources to be able to deliver care to patients with the highest needs. Our caregivers are providing exceptional care in this time of crisis, and working together, we can pull through this challenging time. Those are my comments, Governor. Thank you very much.
Dr. Silverstein, again, thank you for being with us today. Thank you for sharing with us and the public what it means to be in this kind of unprecedented hospital crisis, and why it's necessary and so important that we all do our part and respond accordingly by utilizing emergency care when we do need it and not when we don't, by going to other test sites to get your test, your COVID-19 tests, and not to the emergency room, and to understand that each of us can help by wearing a mask, preventing the spread, and getting through this surge in COVID-19 cases. And so I know we've had a number of members of the media who have joined us. We appreciate, again, your attention and your help in getting these messages out to the people of Delaware. We'll take any questions that you might have at this point.
Thanks, Governor. The first question will come from Tiana Sermons, who is of Lights, Screen, and Action. Tiana, I will unmute you now.
Hello. Oh, I have no idea why my camera is blurry.
There you are, Tiana.
Yep. So hello, everyone. I'm Tiana Sermons. I'm in 6th grade, and I'm a student here in Delaware. I'm actually at school right now. And so my question for you is, what do you see will happen in the future of COVID-19 in terms of schools? And just hoping that we can get to a better place, since it's kind of like we're starting back at square one with this new variant, and now having to go back to masks being mandatory inside.
Yeah, so first of all, thanks for joining us once again, and thank you for the really good work that you do as a student journalist, and for joining us today. First of all, our number one objective has always been, as I've mentioned so many times on this press conference, is to keep all Delawareans safe, and in doing so, to make sure that our children in school for in-person instruction. And it's been something that we've wrestled with from the beginning. First, in understanding the impact and the effect on children and teachers and staff within school buildings, and we've learned that schools are safe environments. They do require the structure that schools provide with mask wearing and social distancing, and the care that I've seen in visiting schools. And so we continue to hope to be able to keep our schools open for in-person instruction. We know that some schools will have to close, mostly because of employees, of teachers and staff that are not able to come to work because they have tested positive, or their close contact, a family member tested positive. Ultimately, the goal, obviously, Tiana, is to make sure that you and your fellow students get the education that they need to be successful, and the education that they deserve. It's never been more challenging. Our thanks go out to teachers and staff that have been doing it now for the good part of 2 years, but we'll continue to meet that objective to try to keep children in school. We know that remote learning is not as effective for lots of different reasons, and have negative consequences on students and faculty alike.
Thank you.
Thank you very much.
All right, our next question comes from Ann McCormick of 6 ABC.
Hi, Governor. How are you?
Good, Ann. Thanks for joining us.
Of course. Question for you. Wondering what the benchmark is for any possible further mitigation efforts. You know, a lot of people see mask mandates come, they get nervous, thinking back to what we're going through previously. And I'm wondering if there's been any discussions about at what points you'll make any decisions about further mitigation efforts.
Yeah, so a couple things. One is we've learned over the last 2 years not to look for benchmarks that you can make decisions, because they are all, it seems like each variant is a little bit different. And this situation we find ourselves in is very different than the last one. We've got lots of people vaccinated, high percentage of people vaccinated, a new variant that's highly contagious. There is some science that's it's less serious, and yet our hospitals are full with patients. So first of all, we want to see that hospitalization number peak. Part of that is going to be our effort to decompress, working with the National Guard so that the hospitals can discharge patients that don't need hospital care and that'll be fine in an alternative care setting. Bring that number down, see our positive cases and percent positive peak, and then hopefully decline sharply on the other side, as we've seen in the past surges. But what we know about is each surge seems to be a little bit different. So I'm staying away a little bit from identifying a benchmark that says once we hit this level of hospitalizations, we're going to take the mask mandate off. I don't want to have the mask mandate on one day longer than we have to. And we've had that conversation with those who are business establishments that are suffer the most during those conditions. I can tell you that our hospital partners would prefer us to have them at mask mandate all the time prior to this and going on forward. Obviously, we're trying to strike the right balance there, and it's very difficult. Hindsight, of course, is 2020. We've seen where we've been. It's a little bit uncertain where we're going, but we think that we've got the right approaches: decompressing hospitals, focusing on testing, focusing on getting those who aren't vaccinated, and really leaning into helping our hospitals decompress.
Our next question is going to come from Meredith Newman from the News Journal. Meredith.
Just to follow up on that question, Governor, what steps are you prepared to take in terms of protecting hospitals if the immediate actions like the mask mandate and the National Guard coming in don't provide immediate relief?
Yeah, so as I just said, and I think you've asked this question, a question like this before, we kind of take one day at a time and assess the situation, try to figure out with the best advice. We pay much attention to what's happening in states around us. I would note that the states directly around us do not have a mask mandates at the moment, something that I considered as we moved in this direction. They're in a little different place, I think, with hospitalizations, but my focus right now, Meredith, is on that hospitalization number. We communicate with our hospital leaders on a regular basis. That's really the great thing about Delaware. We can get all the hospital leaders on a conference call whenever we need to. What are the conditions of your emergency room? What's the help that you need? I'm confident that we'll be able to make headway in decompressing with our approaches. I think the main thing is to get our CNAs, our National Guardsmen and women, ready to go so that the hospitals can discharge people that don't need to be there. The estimates of those patients are north of 100 based on the reports from our last call. And that's going to be our primary focus now. And then we'll meet further situations when we get there. We do, I expected, as you'll recall, that we would be able to accomplish protection by a voluntary mask requirement. It didn't seem to be working. And so we had to move to this. And you probably don't hear about it, but there's a fair amount of pushback, and hopefully it won't be, it'll be more productive than not having one.
Our next question is going to come from Joe from Delaware Public Media.
Good afternoon, Governor. In a mask mandate, you didn't include churches. Now, does that have to do with the pending litigation? And if so, how frustrating is that for you?
Yes, there's litigation nationally on this issue. We're involved in litigation here at the state. We would encourage people. I encourage my mother, who goes to church every day, to wear a mask. And we would encourage others who are going to church or places of worship to wear a mask as well. But we've got those litigation concerns that I've mentioned that I won't comment anymore on.
Our next question is going to come from Howard Monroe of CBS 3.
Hi, good afternoon, Governor. You sort of already answered the question that I had regarding, but when will you know if this mask mandate is working? That might be better for one of the doctors on here, but when will you guys know if this mask mandate is working?
Yeah, I'll turn it over to Dr. Rattay for her observations. I'm not sure what we'll know, whether once we peak out, whether we're going to peak at some point in terms of the rise in cases, the rise in percent positives, the hospitalizations, whether we'll be able to point to one thing or another about what did that. I think we'll leave that up to the scientists. Dr. Rattay?
Sure, it's a great question because oftentimes mitigation strategies do take several weeks to really have an impact. And so, we're now past the holidays where a lot of gathering took place, a lot of maskless gathering took place, and we have high levels of COVID right now. So increased mask wearing in public and private settings. I want to emphasize private settings again. It will, will have an impact if people comply, but it may take 1 to 2 weeks for us really to see the impact of that mask wearing on our cases. And then that would be followed by a decrease in hospitalizations.
Our next question is going to come from Andrew Sharp of the Delaware Independent.
Hey, good afternoon. My question is for Dr. Silverstein. Just wondering if he can give a little historical perspective on how bad this is in hospitals. Are you, do you run at or near capacity in non-pandemic years with flu season and stuff like that? And how much worse is this than past years?
Sure. Thanks for that question and a chance to comment on that. As I mentioned in my comments, we've never activated or implemented these crisis standards of care. So we are stretched beyond, and that is a combination of the volume of patients that require our services and our ability to provide the staff and supplies to do that. So we certainly have seen surges in the past with flu. I would say that the numbers of patients that we're seeing are extraordinary and precedent setting.
Thank you, Dr. Silverstein. We have a few questions that were pre-submitted online in advance of the briefing. So the first question we have is from Alyssa Bainbridge of WRDE. And Dr. Rattay, I believe this question is probably for you. We hear some people saying that cloth masks don't protect against the Omicron variant. Is this true? And will there be any requirements regarding the kinds of masks that can be worn under the new mask mandate?
Yeah, it's a great question. And I know a lot of people are interested in talking about this right now. CDC just updated their science brief on the science supporting mask wearing in December. They cite a number of studies that demonstrate that cloth masks are effective in decreasing the spread. We are, however, dealing with a new variant, Omicron, which is more contagious. And so while we know, and the studies show that cloth masks can make a difference, because Omicron is so contagious, it's really important that we step it up a little and wear the most effective masks that we can. And so, as I mentioned, that means multiple layers of material. It also means a tight fit around the nose and the face, as we talked about. So cloth masks can work, but they really need to fit that criteria. So there are other masks that we talked about, like the KN95, or wearing a surgical mask with a cloth mask that can make a difference in being even more protective.
Thanks, Dr. Rattay. I think we have time for two more questions here. So the next question comes from Chris Barish from WHYY. Chris asks, this question's for the governor. Why did you wait until now to institute the mask mandate when your health advisors have been predicting the super surge and overwhelmed hospitals for at least 2 weeks?
Well, of course, what I've been saying, as Chris knows, from week to week as we do these press conferences, is we take one day at a time. Hindsight is 2020. Obviously, we know where we are now, but we could never predict where we would be. I always thought we could do the mask requirement in a voluntary way, and said that several times over the last 3 or 4 weeks, and that with the expectation that private businesses would take that step to, they know their environments so well, and to be able to make those decisions. It appeared that wasn't working, both in the numbers and as I circulated in the community. And I didn't, with the hospitalization number reaching crisis proportions as it is, I didn't want to leave any tool on the table to try to stem the tide of new positive cases and more importantly, any additional hospitalizations. And so we took that in light of the circumstances and the situation in the hospitals. Hopefully it'll be meaningful, it'll work. As Dr. Rattay just said, it won't have an immediate impact. And that's why we're focusing our efforts on helping the hospitals decompress, allowing them to discharge patients that don't need hospital care. They've estimated that number to be over 100 That's a big number when you're talking about 734 and you're busting at the seams. And so we'll continue to make those decisions based on the information that we have on a day-to-day basis, and then, of course, evaluate the actions that we took or didn't take in hindsight.
Thanks, Governor. And now the last question will come from Mary Lou of WGMD News. I think this question is for the healthcare practitioners on the call, but Mary Lou asks, if Omicron is a less serious variant than Delta and the others, why are the hospitals now implementing crisis standards because of the strain to their facilities and resources? With the original virus, it seems the hospitals weren't as impacted, and that was before any vaccine. So Dr. Silverstein or Dr. Rattay, could you go into a little bit more detail about Omicron versus previous strains?
I can start with, the implementation of crisis standards of care is in response to the inability to keep up with the demand for healthcare services. And we're seeing that now that we weren't seeing it before. That's why we're taking this step now. Omicron's been regarded as mild, and there's nothing mild about the situation that we're in. These are dire circumstances, and this is an unsustainable moment for us in terms of our ability to keep pace. So while the infection with the Omicron variant is different in terms of its predilection for different tissues higher up in the respiratory tract, and maybe therefore causes more mild symptoms, particularly if you are vaccinated and boosted. The fact of the matter is that many, many more people are infected. And so particularly amongst the unvaccinated, we're seeing severe disease. The people in our hospitals are critically ill. They're only getting into our hospital because they are really, really sick. And the numbers are just, you've heard them on this call. They're just unprecedented. And the reality is that some of that is preventable through vaccination and then through the social distancing and masking that we've been talking about. So this is the opportunity to say, go get vaccinated, get a booster when you're eligible, wear your mask, socially distance, be mindful of your interactions.
Yeah, and I'll just add that that was a great answer. I saw a video that I think many of you just saw from Dr. Kelly Abrisha, who's an ED doc in Bay Health. And her observation is that people are showing up very sick and are very surprised that they're so sick because they think that this Omicron variant is just going to be a cold for them. And the reality is it may be just a cold for some people, but many people are, having much more severe illness. And it's really important that I think we dispel the myth that this is just mild and isn't going to affect anyone.
Thank you both. That's all we have time for today. So back to you, Governor.
Thank you, Emily. And whether it's Delta or Omicron, the number of people in hospitals across our state is at an unprecedented crisis level, over 700 at 734, still going up as we're counting. But each of us can do our part by wearing a mask indoors and in private and public spaces, being careful when being in crowded spaces, avoid those if you can. We've got hopefully a couple more weeks to get through this, to peak and see the other side. And we need all of us to pitch in to do that. We thank the National Guard for coming up again big to help our hospitals, both in doing their non-clinical. I think I said unskilled earlier. I didn't mean unskilled. I mean non-clinical. These are very skilled, dedicated public servants. They're on the ground now. The cavalry has arrived. We are having close to 100 trained BCNAs to help decompress our facilities, our hospital facilities, to get over on the other side. We need your help though, by wearing a mask, by being socially distant, by being careful. There is incredible amount of virus circulating in our community. Almost 30% of the tests that we're doing are testing positive, and we're testing at unprecedented levels. Nearly 80,000 a month, 60 to 80,000 a month, and more coming with the FEMA testing site coming in the next little bit here. So thanks for joining us again. Thank you for Dr. Silverstein for being with us, to representing Christiana Care, all the physicians and nurses there, and all the hospitals up and down our state. We appreciate your great work and being there when all of us need you. Thanks very much. We'll see you next time.